Hi, you are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of In the Ladies' Room with Dr. Donica. Today, we are taking a departure that we have only done twice before, and that is our guest is only our third gentleman to enter the ladies' room. He is the author of the Penis book, so you know why I had to invite him. Dr. Aaron Spitz is a urologist and a leading expert in male sexual health and fertility. His stated goal is to empower men to live their healthiest lives by giving them the tools and the advice that they need. But he knows that he can't fully do that without reaching out to the women in their lives. Now, of course, not only are women generally the ones who get men to get their butts to the doctor, but we're often also the health CEOs of our immediate and extended families. And it means we're kind of bossy. So just like women, many men are reluctant to do the things they know they need to do to maximize their overall health: healthy diet, exercise, get enough sleep, have regular medical checkups, etc. But what Dr. Spitz has cleverly figured out is that he gets them to pay a lot more attention to their overall health when he talks about how these issues can also impact their sexual health, which involves a lot more than potential erectile dysfunction. Today, Dr. Spitz and I are going to talk about common myths and misperceptions about men's sexual health and what he calls sexual anti-aging, a proactive approach that men and women can incorporate into their daily lifestyles. Dr. Spitz is the director of male reproductive and sexual medicine at Orange County Urology Associates and a regular contributor to the TV show The Doctors. He serves as the chief representative for urologists to the American Medical Association and is the immediate past president of the California Urologic Association. He's a nationally recognized expert in male fertility, contraception, microsurgical vasectomy reversal, low testosterone, erectile dysfunction, Peyronie's disease, which I'm going to ask him to tell you about, and telemedicine. He received his medical education at the Weill Cornell Medical College, did his internship and residency at LA County and University of Southern California Medical Center, and did his fellowship training at Baylor University College of Medicine. He's also, as I said, the author of the Penis book, which is not just a comprehensive guide to everything you need to know about one of the body's least discussed organs, but also one of my favorite things about the book is an easy-to-follow, holistic 5-step plan for optimal penis health, including penis healthy foods. I didn't know there were penis healthy foods, and suggested exercises to maximize penis well-being. So you know I want to hear all about that. Dr. Spitz, welcome to the ladies' room.
Thank you. It is a pleasure to be here. And I have to say, this is the first time I have been inside the ladies' room, and it's a little tidier than I expected it to be.
Well, in general, the ladies' rooms are much tidier than men's rooms.
I figure they probably are.
Yeah, I always ask my women guests to tell me their most unique, interesting, or different experience that they've ever had in a ladies' room. And since this is your first time in a ladies' room, why don't you tell me the most interesting experience you ever had in a men's room?
Gosh, I would say I don't really have anything, crazy to tell. And if I did, I probably wouldn't, because, that would violate the treaty of the war between the sexes. But I will tell you that when I go into the men's room, I probably approach it a little differently than most men. I have my ear out for the sound of the urine hitting the urinal wall, because as a urologist, I'm very sensitive to the fact that a lot of guys have weak streams. And when I walk in there, I'm just sort of, scouting out new business. So I think that's sort of a weird, that's sort of my weird confession of what goes on in the men's room when I'm in it.
So I have been guilty, and I guess most physicians have been guilty of this, but I never asked another doctor this. But when you're out and about, or I'll speak for myself, when I'm out and about, if I see somebody on a train with a facial lesion, or, a droopy eyelid or drooping one side of the face. I always feel this conflict about, I want to say, have you had that checked out? But I don't want to intrude. But I would imagine as a urologist in the men's room, do you ever see something where you say, hey, buddy, here's my card?
That runs the risk of a black eye. So no. The last thing a guy standing at the urinal wants is the guy next to him going, ooh, you really ought to see somebody about that. So
etiquette. I asked the man in my life about this once. And I said, is there some bro code where you're not supposed to make eye contact? Do you talk? Do you not talk? In the ladies' room, we talk, but we have stalls. So we're not watching anybody do anything at the same time.
Yeah, I would say there's really not a lot of talking. And if there is, it's pretty much a first degree relative like your son. And it's pretty much, hey, stop that. That's pretty much the extent of the conversation, I would say. I was just in the men's room yesterday with a friend of mine who's retired now and has way too much time on his hand. And as we approached stalls on the exact opposite end of the row, he starts explaining to me the nuances of the cappuccino machine he has and how excellent the foam is. And I'm just dying because this is not conforming with bro code stall talk. So yeah, I would say, and maybe that explains why you ladies take so long. You disappear to the bathroom and it seems like forever before you come out, and we're in and out. I guess it's the conversation. We're trying to figure out what the heck are you guys doing in there? What anatomically could require that much time? But I guess it's all about the conversation after all.
Well, and we always, whenever we can, we go with another woman. That's right, because of the conversation. And that's why I started this podcast. And I talk about that in episode 1 is because I wanted to capture some of the flavor of those conversations, which are some of the best conversations I've ever had. But also we do have a lot of men listeners, and I only know that because they send me a lot of questions. And I know that the number one thing men say to me when I tell them about this podcast is that they always wanted to know what women talk about. Now, one thing we don't generally talk about, and in fact, in all my years of using ladies' rooms, I can never remember a conversation where we talked about a penis. So
and that's really ironic because
we talk a lot about dicks. But
not the little head, not the little head.
Right. We do. The first thing we have to distinguish is the difference between a dick and a penis.
Yes.
And I always make that distinction when men are talking about breasts. There's a difference between a boob and a breast. So the distinction between a dick is a person and a penis is an organ.
And a person can be both a boob and a dick, interestingly.
This is true.
And it has nothing to do with gender fluidity.
And most boobs I know have been dicks. So anyway, I love your book, and I happen to have it with me because I was cramming for this conversation, the penis book.
Excellent.
I love the title. You got my attention.
Thank you.
Love the eggplant.
So I had you at penis.
I'm sorry?
I had you at penis.
You had me at eggplant.
Oh, okay.
Well, and it occurred to me when I was in residency, and I did a residency in OBGYN, the first time we had grand rounds, this was in the old days with real slide projectors and the 35 millimeter slides. And the attending showed a giant photograph. It took up the whole screen of the most disgusting penile lesion I or anybody in the room had ever seen. And he opened with this slide and he said, who can tell me what this lesion is? And we all guessed like the worst STD lesion we could think of at the time. And we were all wrong. And he said, I show this slide for 2 reasons. The first is to remind gynecologists what a penis looks like. The second is to remind you the importance of taking a history. You know, none of you asked me anything about the patient's chief complaint or the patient's side of the story. And it turns out it was a zipper injury.
Oh.
It was an infected zipper injury.
Okay.
And of course, you know, none of us got that because we didn't ask what happened.
This is before Something About Mary came out, I take it.
Yeah, and I didn't even see that. So.
Okay. Zipper injury features prominently in the film.
So how often do you see zipper injuries?
Actually, not that much. I would imagine it's probably more of a pediatric urological situation.
Well, this was a grown-up.
Yeah, most grown-ups have kind of learned their lesson. I mean, I know I learned mine after one or two of those. But yeah, not a whole lot. I mean, I have seen one or two in my career, but we do see trauma to the penis from time to time, and probably the most, the most sensational trauma we see is the penis fracture.
Mm-hmm. I was going to actually ask you about that because I got asked, I got contacted by a reporter who asked me to talk about the most common sex injuries. And I, of course, talked about the most common injuries that happen during sex. But then, of course, she asked me about a penis fracture, which is not the most common. But tell us about what a penis fracture is and how common is it?
So a penis fracture is not common, thank God. But, in my career, I've seen several. And it's one of those injuries where everybody's shocked because you always hear the same thing. I didn't know you could break that. And what's happening is an erection is the result of two chambers that sit side by side that make the penis hard. These are chambers that fill up with blood. And the more they fill, the more they expand to a point, and then they can no longer expand anymore. And so then the pressure just goes up and they get harder and harder. And that's what makes a firm erection. Kind of like when you pump up a tire, the tire will first expand a little bit and then it'll just get harder and harder. And what a penis fracture is, it's like a tire blowing out. Something hits at the wrong angle, too hard, too quick. She zigs while you zag, all right? And that pressure goes up just so intensely that it actually ruptures the lining of the chamber that's filling with blood, just as a tire could rupture if you hit a curb too hard and that air pressure goes up. And instead of air rushing out of a tire, you've got blood rushing out of this chamber, but the skin doesn't break. The skin's real stretchy. So the skin is not broken and there's a bunch of blood rushing out of the chamber under the skin, and the penis swells up dramatically and it looks like the cover of my book. And we call it the eggplant sign. And the funny thing is when I wrote this book and the publisher showed me the cover they had come up with, I thought, my God, why do we want to feature a fractured penis on the cover of the book? That's not really the message I want to be sending. Why isn't it a banana or a cucumber? And my 20-year-old son happened to be in the room when I was raising this question with my wife, and he said, "Dad, that's perfect." I said, "Why?" He said, "Because that's the emoji everybody uses to mean penis."
And you didn't know about the emoji.
I had no idea. And in fact, pretty much nobody over 30 that I've spoken to seems to know about that.
I knew.
But I'm only
a few weeks over 30.
That's right. That's right. But no, I still continue to get the same question. Why an eggplant? Is this a cookbook? It's real pretty, but why an eggplant? And that was my reaction too. But anyway, a penis fracture looks like an eggplant. It really does. It's so swollen and dark and disfigured. But it can be fixed, thankfully. And it's just a matter of patching up that rupture in the chamber, and it's done as an emergency surgery. And fortunately, in the vast majority of cases, guy gets back to normal. He's got to take a break for about 4 to 6 weeks, but he gets back to normal.
I imagine that's
I don't know if his partner ever recovers from the psychological trauma of having broken a man, but the guy ultimately gets back in the saddle again.
Maybe not with her. Or him.
There you go.
With the same partner. Anyway, so you talk about how the book is not a cookbook. However, I was very impressed that there are dietary recommendations that you make as part of your 5-step plan. And I want to get right into that because I know everybody is taking notes. But if you're driving, please put the pen down or please pull over because this is really interesting and really important. So it never occurred to me in a million years that there were foods that could enhance penis health. So what are you talking about healthy penile or foods that are healthy for your penis?
Well, the interesting thing about the penis is it's really a window into the health of your circulation. And so therefore of your cardiovascular health. And by that, we mean your potential to get a heart attack or a stroke. The penis is filled with these tiny blood vessels that fill up those chambers I mentioned that can rupture in a penis fracture. And when the blood fills these chambers, it's actually going through this tiny meshwork that's like a sponge of tiny blood vessels. But these blood vessels are made of the same kinds of cells and react and act in the same way as all the blood vessels throughout your body, including your heart and your brain. And foods that are good for those tiny blood vessels in your penis allow those blood vessels to work optimally, to fill up with blood and give you a good, strong erection. But they also allow all the other blood vessels in your body to be healthy. And therefore, what's good for your penis is actually what's good for your heart. And this book, although it's geared towards the penis and penis health, provides dietary recommendations that, in fact, is good for your health and longevity. And therefore, when we talk about something like sexual anti-aging, we're really talking about anti-aging in general. So the foods and the dietary and lifestyle consideration and the supplements that I talk about in the book, and I do, you're right, give a fair amount of time to that topic, because ultimately, at the end of the day, that's going to make the most profound effect on a person's health, from their penis, to their heart, to their brain, to liver, all organs, are geared around the science and understanding of nitric oxide primarily. Mm-hmm. Nitric oxide is this really amazing molecule that has been one of the most important molecules since the Big Bang. When our planet finally cooled down enough for interesting molecules to start to form and glom together on the way towards life emerging.
When you said the Big Bang, I thought you meant nitric oxide, nitric oxide and the role in orgasm.
There you go. You're right. Both Big Bangs. So nitric oxide is this fundamental molecule, and what it does in blood vessels is it sends a signal that sets off this whole cascade of reactions that allows the blood vessel to relax and open up so that more blood can flow through it. And foods that promote nitric oxide are typically vegetables. So a diet that is really plant-based and centered on green leafy vegetables and beets. Beets is a great one, and nuts. Stuff from the produce section provides the building blocks, the molecules that allow our body to produce more nitric oxide. And here's the thing. As we age, and by age I mean get past 30, 35, not all that old, our body starts making less and less nitric oxide within its own blood vessels, because we synthesize nitric oxide, and that starts deteriorating. And so even at that relatively young age, it's important for us to start focusing on a diet that replenishes that. Exercise also stimulates the production of nitric oxide. So exercise and diet, the stuff that we're told over and over again is good for us, is truly good for us, even at this very granular molecular level. And then there are supplements too that we can take to boost nitric oxide. But let's be clear, there's no substitute for a good diet. You can't treat yourself like crap and eat horrible stuff and lay on the couch and open up a bottle and expect to repair all the damage. But there are definitely supplements that also have been scientifically shown to boost that nitric oxide. One such well, I would say the most exciting supplement that I have encountered, and it was exciting enough to where I approached the developer of it and said, hey, I want to actually get on board with this supplement. I wrote this book. I'm an expert in sexual medicine, but I've never put my name behind a supplement because, as you and I both know, our reputations really are our most valuable asset. And I'm not going to compromise my reputation for, some flash in the pan supplement that might, not be any good. But this one I did. So I am actually a spokesperson for this supplement. I'm a paid spokesperson, so everybody knows that. But I really think that this supplement is very exciting based on the science. It's called Revactin, okay. Revactin. can be found at rebactin.com. And what it is it's based around ginger. And it's got 3 other ingredients, which include L-citrulline, which is an amino acid building block of proteins, and 2 plants from Brazil, guarana and marapuima, which have over the years been seen to be effective at promoting erections. But it was developed by Dr. Jacob Rafer, who was one of my mentors. He's a professor of urology at UCLA, and he's the guy that figured out how erections work and how nitric oxide is the key to blood flow in erections, as well as in blood vessels in general. And it was his lab that set to work to see, okay, there's a lot of companies that are coming out with natural Viagra, but what natural ingredients really do act like Viagra? And so they systematically went through and studied a whole bunch of different ingredients, and they saw that ginger caused the production of nitric oxide in the laboratory 20 times better than any of the other, 15 or 20 other ingredients they studied. And then they knew that L-citrulline gets converted to L-arginine to nitric oxide. It's the best amino acid that converts to nitric oxide. And then they saw the results with the Brazilians. So they threw that stuff together, and then they did very formal research on rats. And they took rats that get diabetes, so they age very quickly. And they studied the effects of this supplement on the rats' blood vessels in their penis. And lo and behold, they showed that the blood vessels in the penises of these rats didn't age. In fact, they actually had a reversal of aging. Wow. And I looked at the histological slides. I saw the data at a scientific conference well before this product ever came out on the market. And I was blown away.
And did they look at the histological evidence in their coronary vessels as well, or just in their penis?
No, they just did, because the penis is filled with vascular endothelium. So it's the same kind of, lining and structure as you're going to find in any blood vessel. And the results were so compelling to me that I reverse engineered his slide deck, and I started taking those ingredients myself and called him up a few months later and said, hey, this is what I'm taking. He said, yeah, you kind of got it right. But they did some dose titration studies and in fact kind of found the optimal formula. But then they happened to get some human penis tissue when they were doing a surgery on the penis, and they ran some very sophisticated chemical assays, and lo and behold, this process is happening in human penis tissue as a consequence of this kind of a supplement. So this to me is a very exciting supplement because it is causing the tissues in the penis to produce more nitric oxide when after, like I said, our mid-30s, that drops off. And it's that nitric oxide that is required to set everything in motion for the erection to happen.
And are there clinical trials that have been done?
So this product just came out. They did do a human trial that demonstrated a statistically significant increase in erections in guys that had some degree of erectile dysfunction, but also probably more importantly that it's entirely safe. There were no adverse reactions, and I wouldn't expect there to be, given the ingredients are, just all natural plant-based ingredients. But, a supplement like Rebactin, a diet that's plant-based, minimizing added sugars, exercising regularly, getting a good night's sleep, all components of a lifestyle and a diet and exercise regimen that is good for your penis, but truly is actually good for your whole body.
So many times when we talk about foods, for example, or a diet that's good to eat, we also have to talk about the things you absolutely shouldn't eat. So you did mention sugars and processed foods, but similarly, when we talk about supplements of things you should take, we also have to talk about things you should not take. So talk about the effects of alcohol on the penis and the effects of smoking on the penis.
Yeah, so alcohol is a toxin to all our cells if you take it in excess. There's some good information that a glass of wine a night may be very, very good for you, or perhaps it's neutral. But when you start to get to excess levels, not only are you damaging cells in general, but you also start to damage your nerves. And if you are really an excessive drinker and you're starting to get cirrhosis in your liver, you can start producing excess estrogen as a guy. And that is the female hormone that's going to have a negative effect on your erections.
Well, you don't even have to have cirrhosis for that to happen. You could also have fatty liver disease or obesity. Sure. And of course, with 30% or 30 to 50%, depending on whose data you look at, of adults being significantly overweight to obese. Talk about the effect of the man belly on the penis.
Yeah, so this excess fat that guys carry, and unfortunately even young guys these days in our society, typically, the pot belly was just a sign of middle age, but no longer. This fat is actually producing toxins, and those toxins are going into the bloodstream. And just as nitric oxide is this wonderful molecule that allows the blood to flow and actually counteracts aging at the level of our mitochondria, nitric oxide is in there playing defense. It's playing defense against the offensive toxic chemicals that largely are coming from excess fat.
Well, and the most important toxic chemical, I would assume, with respect to the penis or penis health or penis size, is estrogen, because that is hormonally active.
That's an obvious one, but even in guys who have excess fat on their body whose estrogen levels are normal, because if you go and test, let's say you're an overweight guy and you listen to this podcast, you see your doc and your testosterone and your estradiol level are normal, you're not off the hook, because there are a lot of free radicals that are also being belched out by these fat factories, little poison factories. And these free radicals are going around and they're wreaking havoc on your blood vessels, and they're wreaking havoc on your organs. And it's directly from the presence of the fat itself. And this idea of being fit fat, it's kind of a half-baked idea. There really is a difference in your overall health when you lose weight, just by virtue of getting rid of the fat from dumping into your circulation. And the estrogen is a real issue. Our testosterone that we create from our testicles primarily circulates throughout our body, and in the fat cells, it gets converted into estrogens. And so if we're lean, there's less of that conversion over from testosterone to estrogen. The fat itself doesn't make the estrogen, but it converts the testosterone into it. And it's a vicious cycle, because the lower your testosterone is, the harder it is to shed fat, and the harder it is to gain muscle. And so you can get into this vicious circle where you have low T, and then you're fat, and then you're fat because you have low T, and then you have low T because you're fat. So
and fat also, the added effect is that fat also stores estrogens. So there's this mistaken notion that testosterone is the quote unquote male hormone and estrogen is the quote unquote female hormone. And I think most men and most women don't know that they also have the other hormone. I actually love telling a story about when my son was in 8th grade and they were about to have the talk in health class. The teacher handed out this questionnaire that they were supposed to do as like a pre-talk survey. And there was about 20 different scientific, anatomical, biological terms that had to do with sex and reproduction. And they were supposed to check off whether it affected men, whether it was for men, women, or both. Oh. And one of the terms was testosterone. And my son correctly checked off both. And the teacher marked it wrong, because the answer she was looking for was men. And he, was furious because he did not take well to getting things marked wrong. Interestingly, the other thing she marked wrong, and I had to have a little chat with her about this, was ejaculate. And he checked off male. He checked off both, and the answer she was looking for was male. And he challenged her, and she said, how do you know that women can have an ejaculate? And he said, my mother was talking about it on The View.
That is hilarious. Well, I'm glad you mentioned that, because I see men frequently who are seeking testosterone therapy, or maybe even are on testosterone therapy, and they have a misconception that the less estrogen, the better. And it is true in the context of what we were talking about with obesity, that you do want to lower your estrogen, but in fact, men need some level of estrogen for good health, particularly for their bone health. So
I thought you were going to say they need it for their personality.
But well,
they need to have a conversation.
There may be to do that, but I mean, it's also unhealthy to try to use medications to drive your estrogen as low as it can go, because we do need some of that as men, just as women need some amount of testosterone, although the levels are very low in both cases, but it's a balance.
Well, and that's what happens when women go through menopause, is their ratio. We always think about menopause as estrogen levels decreasing, but relatively speaking, testosterone is increasing. And that actually can have some very beneficial effects as well as some very unpleasant effects. But let's talk a little bit more about this issue of low testosterone, because of course everybody's hearing all the commercials about low T, and I think everybody's confused. When we think about men who take testosterone supplementation, some of us think about bodybuilders who are using it inappropriately. Some of us think about men who have various cancers. Some people have issues or thoughts about somebody who's very elderly. But what are the indications? First of all, what are the indications for a man who should have his testosterone level tested? This is not something that all men should have tested at a certain age, correct?
True. Testosterone testing is not considered appropriate as just a general health screen. But let me begin by saying that for those men who need testosterone replacement, it's quite safe all in all. So I don't want men to be scared off from getting treatment that they in fact need if they need it. The problem is it tends to be oversold. So the person who should get a testosterone level checked is the guy who reports some problem with their erections, because in a high enough number of cases, testosterone can be a cause. It's not always the cause by any means,
is that the
but
first
it can be. That would be the most obvious symptom, because the other symptoms, as you'll see, can easily be ascribed to just the stresses of life, okay? And those other symptoms are fatigue, depression, lack of strength, falling asleep right after dinner. And a person could say, man, I'm just working too hard, or I'm just not getting enough sleep, or I'm just depressed.
And all of those things can also affect your erections, all of the stresses of daily life, plus the stresses of your relationship.
Indeed.
So how do you parse out somebody who's got low testosterone versus somebody who's just got low libido because he's just not that into you?
Right. Well, since low testosterone is associated with low libido and low erections a lot, just those two symptoms alone do warrant a testosterone screen. Okay. But if a guy is coming in and he's 50, he's 70, and he says, my libido is fine, my erections are fine, and I feel that my strength and energy is fine, I don't say, well, you're 70, let's check your testosterone. But if a guy comes in and he's 70 or he's 30 and he says, I'm having trouble with my erections and I don't have much desire. It's true that you could have erectile problems from stress or other reasons, and then not having good erections can kill your libido psychologically, but enough of the times there's actually something there. And so that alone is warranting a testosterone screen. And if a guy comes in and says, you know, I've got low energy, I'm not gaining in the gym, I'm putting on weight, I just really feel like things have really deteriorated, and it's really obvious to me in the last year or two, my erections seem okay. I don't know if I'm interested in sex, so it's not so clear cut on the sexual side, but it seems like, hey, maybe there's something there on the energy and strength side. I'll check a testosterone as well.
And how reliable is, or how accurate or reproducible is a testosterone level?
So a single testosterone level is not all that reliable, because it turns out that those levels can bounce around quite a bit. And if you measure a testosterone and it's low on one measurement, it may well be completely normal on another measurement. And they also tend to be higher in the beginning of the day than at the end of the day. So we will typically check two levels if one is low to confirm that it is consistently low before then going down the path of testosterone replacement therapy.
Okay, and what are some of the contraindications for testosterone therapy? Meaning, no way, no how am I putting somebody on testosterone?
Yes. So that has really liberalized a lot in the recent years. We've gotten a lot more comfortable And we've come to a lot better understanding of how safe or risky testosterone is. So it used to be that if a person had prostate cancer, even if they were treated and cured, that was a contraindication, no testosterone for that guy, because we felt that testosterone caused prostate cancer to grow. But these days, we're a lot more liberal with that. If a person has prostate cancer that's been treated, he's had his prostate removed or it's been radiated, we're a lot more comfortable giving testosterone, because it's not really the more testosterone, the more cancer. It turns out if you were very low and had cancer, and then we brought you up to normal as you were going up to normal, that was stimulating. But if you're not very low, you're just kind of somewhat low, you've already done the stimulation part, and any additional testosterone isn't just adding fuel to the fire. And there are even top-level urologists who are experts like myself who will manage some of their patients who actually have testosterone, actually have prostate cancer in their prostate, but at a very low level, so low that they can just kind of watch them and not require treatment. They may also give them testosterone, but that's kind of pushing the envelope in some cases. But you can see it's really become a lot more liberalized. Another type of patient that I think should not get testosterone is a young man who still desires to have children. Because when you go on testosterone, it makes your own body's production hibernate. And your sperm production is dependent on your own body's production, because testosterone is produced inside the testicle right next to the sperm. And before it ever gets into your general circulation, it's 100 times more concentrated inside the testicle. And so the sperm require levels that are 100 times higher than normal levels in your blood. But when you go on testosterone shots or pellets or patches or creams, that's just replacing the normal level into your blood, which is 100 times too weak for your sperm to grow.
So is that why male bodybuilders who abuse testosterone supplements of whatever kind run the risk of becoming infertile?
Absolutely. You know, there's a stereotype that these bodybuilders have little testicles. And that's actually true, because the volume, the size of the testicles, is primarily a result of how much sperm is being produced. The part of the testicle that makes testosterone is a really small amount of the cells in there. Most of it is sperm. And when you go on testosterone and you go into testicle hibernation mode, they shrink down. Now, fortunately, it's reversible if you're not really pushing that T level up to crazy levels. But bodybuilders often push it way too high. And in many cases, it's not so reversible. But say a guy goes on T for a year or a few months and then realizes, hey, I shouldn't be doing this. In the vast majority of cases, he'll be able to recover, come out of the hibernation, and get back to his sperm production.
Got it. So now let's switch gears. When we've talked about testosterone levels, let's talk about PSA levels. I know this is controversial in some circles about should all men have their PSA or prostate surface antigen levels tested as a screening test for prostate cancer. Where do you fall on that? So
PSA is a piece of information, right? It's a blood test. And there's really nothing inherently good or inherently evil about information. It's really how you use it. And so the bad reputation that the PSA has gotten is because it is not a tightly correlating piece of information. A PSA number doesn't always tell you that a guy has prostate cancer or that a guy doesn't have prostate cancer. It, like testosterone, can vary sometimes from one test to another, or there's a variety of things that can make it go too high that isn't prostate cancer.
Such as?
Well, if you have a colonoscopy and you check a PSA a week or two later, your PSA may be elevated because just the passage of the scope rubbing on the prostate, it's kind of like a suprarectal exam, causes the prostate to release PSA into the blood.
Wow. So how much time does somebody have to wait after a colonoscopy to have a PSA?
Well, there's this thing called half-life, which is how long it takes half of something to disappear out of your system. And the half-life for PSA is very long. So it's about 6 weeks.
Wow.
Yes.
So do you also advise your patients to abstain from regular sex or any kind of sexual intercourse before a PSA?
I don't, unless the PSA comes back high and the patient points out, I was pretty sexually active. We were on a cruise, or it was my honeymoon, what have you. But in general, I don't see it cause an elevation all that much, although it can. Okay. An infection, a urinary tract infection, can make the PSA go to frightening levels.
Wow.
And when I see that, I know that it's likely an infection, because cancer doesn't tend to grow that fast. But again, you got to wait several weeks to see it come down.
And what about the effect of testosterone supplementation on PSA?
So testosterone also will stimulate prostate growth, but not all that much. And so on testosterone, I expect to see the PSA go up, but maybe it goes up half a point or a point. If it goes up much more than that, hey, I might have stimulated a hidden cancer. I don't really see that happen all that often, thankfully. But it is very important that whoever is receiving testosterone has a doctor supervising their prostate status with PSAs and with rectal exams. Sometimes a guy can have a normal PSA, but he's got a tumor that you can feel, but you wouldn't know by the blood test. And the common mistake that some patients and even some doctors make is they just check the PSAs. And as long as the PSA is good, they can skip the digital exam. And you know what? Even doctors like to skip that exam. But as a urologist, that's my bread and butter.
I always talk about that as how a lot of gynecologists skip the rectal exam. And I said the definition of conflict of interest for me was when I was in my mid-30s. I had a new gynecologist, and she didn't do a rectal exam. And I said, okay, here's a major conflict of interest. Do I tell her, or do I just skip it?
Right, exactly.
So how often do men have to be seen in follow-up who are taking testosterone supplementation?
So, there are ever refined guidelines that have come out about PSA checking, but when it comes to testosterone, that's a pretty straightforward one. I will check my PSA before I ever put him on testosterone therapy. I need to know that there's not already a hidden cancer. Okay. If we're good there, I'll check it in about 3 months, because prostate cancer doesn't grow all that quickly. And if we're going to see some kind of difference, if I check it too soon, I'm not likely to pick it up. And if at 3 months we're good, and I check the PSA and the rectal exam both, I'll then check it at 6 months. And if at 6 months we're good, I tend to check it every 6 months, but it's okay if you check it once a year, if the PSA is very low risk factors, no family history, that kind of thing. And that's how we do it.
And so suppose a guy is, let's take 55, 60-ish, and they go on testosterone therapy. This is a very common question I get asked about estrogen therapy.
Sure.
As soon as somebody gets put on estrogen therapy, they say, well, do I have to be on this forever? And my answer is usually, well, no, only as long as you want the benefits. What's the answer for testosterone therapy? Is it the same? Can somebody, if their PSA doesn't change and they don't get prostate cancer, can they be on testosterone indefinitely?
Yes, and it's typically intended to be a lifelong supplementation, because it's not restoring your body's ability to produce testosterone. And in fact, it's putting it into a hibernation. It's shutting it down. And so it's really now a replacement therapy. And at some point in the future, if you want to stop it, you can, but it'll take several months for you to come out of hibernation, and you'll go even lower than where you started. You'll basically be shut down, and then you'll ratchet back up. But when you come back online, you'll be no higher than you were when you started. So it is intended to be a long-term. And that's another reason why it's so important for young men not to get caught up in testosterone if they don't truly need it. I mean, there are a small percentage of young men that need it. Some of them have a genetic condition such as Klinefelter's, where they just can't produce enough. Some of them may have had a pituitary tumor, but those young guys that are out there to try to be optimal, become supermen and think that, well, my testosterone is normal, but even more would be even better, are trading and signing up for what is typically a lifelong therapy.
So, yeah, I said I wasn't going to talk about Donald Trump before this, before we started recording this. But one of the things, so many things about him I find fascinating. But one of the mysteries that we still haven't learned about him is when his doctor released his initial medical report letter. Do you remember when he,
Yes.
that letter about how he was the healthiest, person ever running for president ever in the history of presidencies?
Yes.
If you or I were writing a letter like that, we would put lots of numbers in there. We'd put a height, weight, cholesterol levels, blood pressure, pulse, and whatever the patient authorized us to reveal from their numbers. What was striking about that letter is there was only one number in the entire letter. Do you remember what it was?
I don't. Was it a testosterone?
It was his testosterone level. And I remember that as very striking because with a typical patient, the one number they would not want you to put in there would be their testosterone level. Or they might say, just give the basics, and I don't think that would be part of the basics. And I remember the number was 474. And I remember thinking that for a 70-year-old guy, a testosterone level of 474 would be kind of unlikely if they weren't taking testosterone supplementation. Is that accurate or not really?
No, I see people in their 70s with testosterone at that level. But you do raise a good point, and that is men's testosterone levels do start to decline around age 40. And it is typical that a guy's testosterone level is going to be in the lower end of the normal range as they get into their 70s, 80s. But the lower end of the normal range is going to be sort of in the 300 to 400 range. But certainly I see guys at his age who are up to 600. It's not the norm, but it's not impossible either. A young man might be walking around with testosterone 800 and then decline down to the 400s. But there's also plenty of men who after 40 have testosterone levels that are actually too low. So as much as testosterone is oversold, paradoxically, it's probably under evaluated and underprescribed for those that actually need it. Probably
is there any data? Is there any data about the long-term benefits of or risks of testosterone therapy in terms of life expectancy, cardiovascular status, heart attacks, strokes?
There really is a lot of data around that. Unfortunately, in the media a few years ago, there was a lot of hype around a study or two that suggested that it might be dangerous for your heart. But it turned out that the methodology of that study was really poorly done. And there are dozens and dozens of studies around testosterone and heart health that show that it is actually a benefit to your heart, or at worst neutral, but likely a benefit. And studies have shown that men who have low testosterone that isn't treated have shorter lifespans than men whose testosterone is brought up to normal, or men that have normal testosterone. So yeah, it actually can result in a shorter lifespan if you have low T and don't get treated, or afraid to get treated and are a good candidate otherwise. Testosterone also helps with sugar metabolism. People with low testosterone have a higher risk of progressing to diabetes and obesity, as we talked about, and obesity and diabetes have a link, than men whose testosterones are brought up to normal or who have normal testosterone.
So speaking of diabetes, talk about the link between diabetes and penis health, or
so
lack
diabetes. Of. Yes, so diabetes is one of the most important causes of erectile dysfunction. Diabetes ravages all the cells in the body too. We talk about alcohol as a poison, and so is diabetes. That excess sugar and that incorrect sugar metabolism wreaks havoc on blood vessels and on nerves. And blood vessels and nerves are what the penis is all about. The diabetes causes blood vessels to deteriorate, to age prematurely, and to get fibrotic. And so they can't open up and pump blood through the body as well. And in the penis, all those little blood vessels in those chambers that fill with blood, they can't expand and accept the blood as well. And the very trigger for the blood to rush into the penis in the first place is from nerves. But the nerves deteriorate with diabetes. Not only the nerves in our body that are going to our organs, but our sensory nerves. Diabetics get neuropathies. They get loss of sensation and tingling, and they get loss of sensation in their penis too. And that penile sensation is an important part of the reflex and of the stimulation for the internal nerves to then release the signal to the blood vessels to open up. And so diabetes is compromising all of that. And the thing about diabetes is it's not an easy case to fix. Viagra works great on about 65% of guys, but the population that it really doesn't work very well on is those with severe diabetes.
So tell us how Viagra works, and how is it different from the other drugs for erectile dysfunction? I don't even know what they all are. Cialis and the others. How many are there?
So there's a handful of them.
And you tell I don't have a lot of experience with this.
Yes, no, don't worry. That's my role. So Viagra was the first kid on the block, and all of the other pills are variations on that molecule. And so they all tend to be similar in how hard an erection they can give a guy, but different in side effects, how quickly they act, how long they're in the system. Okay?
And how often you have to take them.
Right, how often you have to take them. But the end result in, head to head, as it were, is probably pretty similar across the board. Although for an individual, one may work better than the other. So Viagra works by turbo boosting nitric oxide. Your body releases nitric oxide when the nerve signal for you to get an erection releases it into the blood vessels in the penis. And then that causes the penis to get hard. And then after a while, another reaction occurs to shut it down, okay? Like a rheostat. Otherwise, if you had an erection too long, which is called priapism, your penis is suffocating. There's no blood, there's no oxygen anymore because that blood is trapped in there. It releases all the oxygen, and after a few hours, it actually really hurts. It's too much of a good thing. So the body naturally shuts that down. What Viagra does is it stops the body from shutting it down as quickly.
Got it.
It lets that nitric oxide effect linger longer. So imagine you're trying to fill up your sink, right? And you turn on the faucet, you got a good strong flow. Well, your sink is going to fill up in a minute or two. But what if your sink had, a little bit of a leak in it? Well, if you have a good strong flow, it'll still fill up even if there's a little leak in it. Now, after years of blood vessel disease, you turn on that faucet, your blood vessels being the faucet, and it's a slow, weak stream. It's less blood flowing into the penis. Well, if your body comes along and turns the faucet off after a preset time, the sink never got filled. But if Viagra comes in and stops the faucet from being turned off as fast, even though that faucet stream is slow, you'll still get that sink filled up. And that's how Viagra works. It lets lower blood flow still do its job by letting that flow be turned on longer.
So at what time does somebody have to take Viagra prior to getting the benefits of the drug?
Yes. So it takes about an hour for Viagra to kick in. And then it's in your system for about 4 to 6 hours. Now let's look at the other ones, Cialis.
Wait. I have one more question about the Viagra.
Sure.
So then what happens if you take the Viagra and then your expected or hopeful activities don't happen?
You spend a little money.
Okay.
Nothing bad happens.
You don't have an erection you can't get rid of.
No. So you actually
it helps
have
you
to be
the erection, but it doesn't help you actually get the erection.
So getting the erection and keeping the erection are all the same issue.
Mm-hmm.
And it all starts with your brain sending a signal down to your penis. If you take a Viagra and then do your taxes, you're not going to get an erection. Okay. You actually have to be aroused for that erection to happen. It's not an involuntary erection. It's taking the process that you actually initiated naturally and allowing that natural process to last longer. There's other medications such as injections that a man can inject into his penis. That is so potent, it can give a man an involuntary erection. And yes, even an accountant can have an erection with that approach.
So we've all heard the commercials that, call your doctor immediately if you have an erection that lasts for more than 4 hours.
That's right.
I guess the first thing you tell them is try doing your taxes and see if it'll go away. But how common is that really? And then what's the treatment for that aside from doing something?
Right. So we call that priapism. And it's named after the god Priapus, who was this fertility god depicted with a very large phallus. And that almost never happens with the pills. I've seen it from the pills once or twice, maybe in my entire career. Where it really can happen, though, is from the injections, which are much more potent. I almost think, in some sort of accidental way, that has become a subliminal marketing tool.
Oh, absolutely. I always said if I was marketing a drug, the first thing I would say is, it may, under the side effects, it may cause weight loss and it may increase your libido. And I would have a blockbuster drug. I actually once saw a case of a guy with priapism when I was in residency. I was working in the ER. And this guy literally came in bent over wearing a raincoat and nothing else. And it turns out that his wife had found out he was having an affair and she got him all excited. And then rather than using lubricant, she intentionally used super glue and super glued his penis to his abdomen in what we call the anatomically correct position.
Wow. Well, that's a trip to the manicurist, isn't it?
Well, it turns out it was, but I didn't know that at the time. And at the time, we didn't have Google. At the time and he just happened to get into the emergency room on a day where it was all women doctors, all women nurses, which in 1983 was a really rare thing to happen.
Sure. Yeah.
And we did call the company we called the company that makes super glue and asked what the antidote was, and it was acetone.
And since then, don't they have a precaution about super glue and penis on their packaging? No, I guess they don't.
So what is the weirdest thing that you ever saw or had to deal with in terms of penis health?
Well, I think one of the more bizarre things is, there's this practice of putting objects under your skin to make the girth larger. There are cultures that do this as part of their mainstream culture, Aboriginal cultures. Well, they will put it under the skin of the shaft of the penis, or they might put a piercing through and through
so that's
the urethra and the glands.
Penis.
No. This is a surgical incision, like home surgery. I've seen this happen in prisoners. Prisoners may do this. I've seen this from certain Central American or South American countries. Pretty bizarre and not a good idea, because what ends up happening in many of these cases is severe infections, inflammation, deformity, things like that. Also there are men who are afflicted with kind of the equivalent of an eating disorder, only, it's their penis, where they are convinced, just as a person with an eating disorder is convinced they're too fat and they, a bulimic or an anorexic, these men are convinced that their penis is too small. And they seek out penis enhancement surgeries to make it longer, to make it thicker. But their penises are completely normal in size. And this, in some cases, is fueled by pornography, which is a completely unrealistic depiction of the penis. And pornography sort of feeds into a lot of insecurities, I think, in many men, particularly younger men, since it's become so ubiquitous and so available.
I actually heard an interesting thing about pornography in the news yesterday, that since the government shutdown, the usage of pornography or internet pornography has doubled in the Washington, D.C. area. And I don't know how they collected that. I think it was from Pornhub data.
Well, you know what? I saw the same thing around the time of that false scare of a nuclear attack on Hawaii. Do you remember when that was in the news? It was a drill.
I was in Hawaii a week before that.
Wow. Well, apparently, when that was announced, pornography viewing plummeted. And then when it was revealed that it was just a drill, not only did it rebound, it exceeded. So
Wow.
there was some
So,
celebratory viewing.
so I thought it was interesting in your book. You talk about how pornography can actually have a deleterious effect on libido or on performance or
Yes, it does. I mean,
self-esteem or all of the above.
right, all of the above. We joke about it, but unfortunately, pornography is actually a public health crisis.
Really?
Um, yeah, men who view pornography frequently, and by frequently I mean several times a week or even daily, have measurable deterioration in centers of their brain when studied with MRIs of the brain, where these centers that are important for arousal and desire actually shrink, actually get
Wow.
measurably smaller. Yes, and so the strange paradox is that this material that's so sexual and so titillating is actually blunting the sexual response of men who are very frequent viewers of it. Fortunately, it is reversible, but it does pretty much require cold turkey, and it'll take a few months to kind of get back to normal. But so many people are watching pornography on this kind of a frequent basis.
So,
Um,
interestingly, have those studies been done in men and women or just in men?
well, you forced me to reveal a little secret, and that is they have been done in men, and women don't tend to have that negative effect as much as men, but women don't watch pornography nearly as much. So I think that there is a difference in how women process pornography versus men,
I
but I
think most
don't,
women I talk to are just not that interested.
yeah,
And
but I don't think you have that. Yeah.
the best comment I ever heard was a woman who said, it's sort of like, why would I want to watch a couple eating a great meal at a restaurant and me be standing outside the window? But
That's a great analogy.
and I am not a pornography expert by any means. So I'm asking this from complete naivete as opposed to it being
Yes.
a leading question. Most of my questions are usually leading questions. But are there any studies about any correlation between the frequency that men would watch porn versus the frequency that they're actually having sex with another human?
Yes, so studies were done on married couples. And in fact, as the frequency of pornography increased, the quality of the sexual relationship in that marriage declined. From the
That's
perspective of
because the wife was pissed.
no, but in those couples that watched it together, there was a neutral to slightly positive effect on the women's perspective of their sexual appetite and sexual desire and sexual satisfaction, whereas it declined for men, and it was dose related, as it were. So probably the safest approach is really to, now and then, not on a regular basis, if at all.
Got it. Actually, my favorite study ever on sexual frequency was done in the late 1990s at Rutgers. And they found a direct correlation between the more housework a married man did, the higher their level of the couple's level of sexual frequency. And I thought that was hysterical. And my explanation at the time is, yeah, because she wasn't furious with him.
That's right. I always try to do the dishes on Saturday nights. Yeah.
Oh, that's big of you. There's six other nights, right?
Hey, I'm 51.
So speaking of sexual frequency, I want to get back to this issue of penis health. And one of the things you talked about in your book that I thought was fascinating was this concept of exercises for your penis. And of course, when I first read that, I had visions of, this penis doing leg raises and things.
Third leg raises. Yeah.
But I do want you to talk about, these exercises that you say, but I also want you to talk about this issue of use it or lose it.
Yeah. So I call it sexercises. And the easiest exercise is just any exercise you're doing because of that promotional effect on nitric oxide and blood vessel health and staving off the negative effects of being sedentary, overweight, excess, all the stuff we talked about. Just any exercise is a good counter to that, and therefore good for your penis. specific to the penis is Kegel exercises.
Really?
Yes,
Wow.
yes. Was that on your son's checklist?
It
For
was not.
class? See,
Or not
okay.
that I remember. But I'm sure the teacher would
So,
have said it was just for women, and I wouldn't have even caught that because I would have thought it was just for women.
right. So, just so there are muscles that surround the vagina and the rectum that squeeze to increase tightening in the vagina. These muscles also squeeze around the base of the penis and the rectum in the man, and also the urinary sphincter of the man. But because they are around the base of the penis, when they contract, they take those chambers that are filled with blood and they increase the pressure in them. Kind of if you took a water balloon and squeezed it, you'll increase the pressure inside that water balloon. And as men get older, just like other muscles in their body, those muscles tend to get weaker. But doing Kegel exercises will help maintain the tone and can give a little added boost to the strength of the erection. And in fact, when studies were done on men that were doing Kegel exercises in a very formalized way with a pelvic physical therapy and with anometric monitoring to see how tight they're squeezing and get that biofeedback, like women can do biofeedback for incontinence, they showed as much improvement as the competing group of men who were given Viagra. I mean,
Wow.
it was actually quite remarkable. Yeah.
And did it have the corresponding benefit of decreasing incontinence in men, or was that study not done?
Well, it can. No, we use Kegel exercises in men that suffer from stress incontinence, most commonly after, say, a radical prostate surgery, for example. But yeah, so actual benefits on the erection itself, but it makes sense because of that function it has in increasing the firmness of the erection based on just its resting tone. And also when a guy is contracting them, and he's contracting them typically involuntarily at the point of climax. And that's also part of what causes the semen to come out, to be ejected. And as guys get older, the volume of their semen and the force of the ejaculation declines. It's no health problem, but it's a consequence of aging. And it's possible that regular Kegel exercises might help maintain that, both erection and perhaps some of the ejaculatory force, and of course the urinary control as well. And then there's an exercise that I recommend avoiding for certain guys, and that's bicycle riding. For certain guys, the shape of their pelvis and the shape of that bicycle seat fit like a lock and key, which is not so good because the blood vessels and the nerves that go to the penis, the nerve that triggers the erection and the blood vessel that provides the erection, run right under the butt bones. And if they fit real tight there and they squeeze those blood vessels and nerves, they can injure them and deteriorate erections. And in fact, professional cyclists have a substantially higher rate of erectile dysfunction than the general population. Bicycle cops, when tested with overnight erection studies, showed less erections than normal controls. Not that they had erectile dysfunction. It wasn't enough to give them a problem, but you could see early signs of it. So
how would you identify? Is there a way to pre-screen which men shouldn't be doing that? Or should they all just be using some kind of special cushion seat? Or
well, I would say every guy should use a special cushion seat. But if you're starting to feel a little numb after a ride, guys can feel a little numb down there. So can women. If you're feeling a little numb after a ride, that's your clue. You need to do something different. Maybe you need to stand more when you're pedaling. Don't sit as much. Change your seat. Tilt the seat a little lower down. Or don't bicycle. Do a recumbent bike, rowing machine, swimming, something else.
Wow. So before I let you go, this has been fascinating. I could go on and on and on. But you said something at the very beginning that I meant to ask you about that, we've come full circle. So you said when you're in the men's room, you sometimes like to listen to the stream against the wall as your, little detective exercise. What does the strength of a man's urinary stream tell you about their penile health? And is their urinary output or the strength of their urinary stream in any way correlated to the strength of their ejaculate stream?
Yes, there is a correlation. It's a weak correlation, but we have come to learn the men who have enlarged prostates causing weakening of the urinary stream, they do have a higher incidence. There's a higher percentage of those guys that also have problems with their erections. And also it's common to have a weaker force of ejaculation as well, because the semen comes through the prostate.
Mm-hmm.
If there's some restriction of the flow of the urine, there can be some restriction of the flow of the semen. And it does turn out that when men have that enlarged prostate problem improved, their erections can improve too.
So basically, when you hear a weak stream, you're thinking enlarged prostate.
Yes, when I hear a weak stream, I'm thinking enlarged prostate. But I'm not passing judgment on their erections.
And you're not telling them.
Well,
this has been fascinating. I have to say, I know I learned a lot. And I never claimed to be an expert in the penis, other than having given birth to somebody who had one, and having pretty much known somebody in my life who had one for quite some time. How do you suggest to women that they broach the subject with their partner if they think there's a problem with their erections, which has got to be one of the trickiest things ever to navigate in a relationship? That's not something that I guess a typical guy wants to hear from his sexual partner.
Right. Well, since we've come to understand that erectile dysfunction is usually a physical problem and rarely a psychological, but not rarely, but not nearly as much a psychological problem as we used to say it was when we didn't have a good answer. We doctors like to blame our patients when we don't know what is causing the problem. And that's what we often did with erectile dysfunction. But since we really now understand that vast majority of the time there is a physical problem at play, it's really about expressing concern for the health and well-being of your partner, not passing judgment on them, not questioning why they don't desire you anymore, or, is there something wrong in your relationship?
I think that's what most women think.
That's right.
And think that he's either having an affair, or he's not attracted to me, or we've lost that loving feeling.
Exactly. And in the vast majority of cases, it has nothing to do with that. It has to do with blood flow. And what that woman will do for that guy is alert him that he may have a health issue going on with his circulatory system, and the penis is sort of the canary in the coal mine. When you've got blood vessel disease, those blood vessels in your penis are so much smaller than they are in your coronary arteries or your carotid arteries, and the penis is the first to go. And that could be the first sign. And if she brings it to his attention that she's concerned about his erections because she's concerned about his health, and she wants him to be around for a long time, and she knows that most likely this is a problem that's physical, and if he gets in to see the doctor, he can make sure he's healthy and also can turn the problem around. And she doesn't approach it from the standpoint of, well, what's wrong with me? Why are you not satisfied with me? She can diffuse the situation. And guess what? It's actually a genuine conversation. It really is about his health. And you really will get a solution that way. But if you take it personally because you think it's a psychological problem, you're missing the boat entirely. I explain all of this to great detail, but in very simple language in the penis book. And the penis book is kind of an easy way to break the ice because it's a funny book. I wrote it with some humor.
I thought just the chapter headings were hysterical.
Thank you.
Yeah, and the number of penis jokes you got into, every sentence it was really talented.
Well, thank you. I'll tell you that, I've had many patients read it. I get really positive feedback, which is gratifying for them. Some of the feedback I get is that, every high school boy should read this book.
Absolutely. I mean, I really think that's absolutely true.
So I think a woman could give a copy of this to her man after she's done reading it, because if she reads it, then she'll really know what's going on. And that's exciting too. But I think the more you know about something, the easier it is to talk about it without anger and frustration.
Okay. And I know you're completely biased on this question, but who does he go see? Does he go see his internist first, or does he come see a urologist first?
I think it kind of depends on the kind of community he's in. There's a shortage of urologists around the country, and there's not a lot of us in the more rural areas. So he may not have the option of seeing a urologist, but if he's in a more metropolitan area where he has ready access to a urologist, that's sort of the gold standard. But certainly, many internists and family doctors, even good physicians, assistants, and nurse practitioners will be plenty well qualified to help.
Great. Well, thank you so much. And I know I'm going to get tons of questions from people about this, which I will pass on to you. Again, the book is The Penis Book. I know that's a title most people are not going to forget. And finally, where can people find you online?
AaronSpitz.com. And also the other website I want to remind people about is Revactin.com for the nitric oxide boosting supplement. And then the book can be found easily on Amazon or Barnes & Noble.
Great. Thank you so much for joining us in the ladies' room. I hope it was good for you.
Oh, I want to come back.
Anytime. Take care.
All right.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.